Before I start, I want to say thank you, and I want to offer recognition to everyone else who presented earlier today. They did a fantastic job. I just wanted to congratulate them all. Good job well done. I also want to congratulate you all for taking out the time on a Saturday to come spend it with us. It's been a very long day, and I appreciate that time you gave us. So I would like to talk today about children and about where they belong in this whole discussion regarding the plant-based diet. Now we talked about today only adults. And
Can you speak up a little bit? You're very low.
oh, do I have to be close to them?
Yeah.
Sorry about that. So yeah, I'd like to talk a little bit about how a plant-based diet will affect children and whether or not it is an appropriate thing to give. Because as general practitioners, we generally are hesitant to offer advice that we feel may be contradicted by our colleagues in pediatrics or other nutrition dietetics. But I want to just try to encourage you, or do some wishes, that plant-based diet is beneficial to all developments of humankind, whether it's a child or a adult. So a little bit about me first before we start. I am a father of two beautiful girls here on the left. My life, and my wife is right there. The reason I began down this path of nutrition was because of my daughter right there on the right. Her name is Jasmine, and she has Down syndrome. Now, when I was going through medical school, I had learned all about Down syndrome from a medical standpoint. I knew exactly what to do, I knew exactly what was happening, and knew exactly what to expect. At least I thought I did. And then she was born, and my perspective immediately changed. And I tried to figure out how I can help her be the best version of her possible. Now, being taught only medical-related stuff, I thought we'll just wait and see how things go and treat the problems as they arise. But as she started to grow and to develop, more problems started to arise. I realized that waiting wasn't a viable option. I had to try and take control of the situation and mitigate any potential problems. And this is where my wife started making me inquiries as to, is there something we can do? Is there something else besides pharmacological and surgical management for my daughter's issues? This all came to a head when she was 6 years old and diagnosed with gallstones. At the age of 7, she had a cholecystitis. So it was at that point that we made a concerted effort to try to change the trajectory my daughter was on. So we started looking into nutrition, and we spent a good year or so. And everything that we saw kept pointing back to one simple thing: nutrition. The better your nutrition, the better your outcome, regardless of what it is that you're treating against. So this is where we started implementing eventually we go down the road towards a whole food plant-based diet. We started slow. First we took out a bit of meat, then we took out a bit of dairy, then we started going down the way towards eggs. But coming from my daughter's and Hungarian as my wife, so that's a very meat-heavy culture. And by the time we started making the changes, it was a bit tricky with my older daughter because she loved her meat. To this day, she loves liver. Don't know how, don't know why. It's the day she did. So we had to be very careful in how we tried to wean her off of those things that we knew contributed towards a unhealthier lifestyle, and which would promote her disease progression. And it took a while, and that's just one thing that I will eventually come back to, is that when you do, or if you do advise a parent or parents to make the change necessary for their children to have a better life in terms of their health needs, always caveat this with, it will take a long time. Right? We as adults are resistant to change, and we are very aware of what's happening and why, and rationalize what's occurring to us. Children, especially the younger ones, don't really grasp that, and so they will take their lead from you. So if you take it slow, they'll be less resistant to the change. I just want to caveat all of that before we start. So, why is all this important? I'm a GP in Norwich at the moment in the UK, and I get a lot of children coming in, well, not that, my parents bring them in, but they're coming with a variety of issues. So it's commonly the same 6 or 7 things. In the younger children, it's going to be earaches, constipation, eczema, that's a general one. As they get older, it'll start trending towards obesity, upper respiratory tract infections, lower respiratory tract infections, and as they reach into the adolescent period, it becomes anxiety and depression. So this is generally the trajectory I see. And it's regardless of socioeconomic group to a certain extent, regardless of race. So I find it interesting that if we can, as a GP, if I can tackle these issues with the parents, then there's less stress on the parents. And there's more productivity for not just the child, but for the family as a whole, as a cohesive whole. Because raise a hand if anyone here has children. Okay. So you're well aware that when a child gets sick, everything stops right in its tracks. So if we can prevent our children from getting sick, then we increase the chance of other things occurring, more positive things regarding the family dynamic. So as I mentioned earlier, these are just some of the things that a whole food plant-based diet can address to some level. Now, I'm not saying it's the cure for everything, but it will definitely support the reduction in all of these issues. Now, the discussions we've had earlier today from other presenters have been quite clear in showing the reduction in obesity, the discussion around constipation. These things are well documented. And what happens with adults generally happens with children as well. There's no difference in that regard. So a whole food plant-based diet will affect all of these in a positive way. So the discussion about obesity has been a hot topic for quite a few years in pretty much all of the Western medias. And in Ireland in particular, it's been getting a lot of traction because it's going to show how much burden will be placed upon our society and upon the medical system, which is already, I fear, at a breaking point. So 1 in 4 children are already overweight in Ireland. And this is just going to increase because overweight children tend to become overweight adults. That's the natural correlation that has been seen thus far. But that can be reversed, that can be changed. It's just a matter of changing eating habits. But the most important takeaway from all of this, in my opinion, as a father, is this one, the reduction in the potential of the child. The more that they're obese, the more that obesity carries with it its side effects, the greater the chance of these occurring, and therefore the worsening prognosis of the child, the reduction in the potential to be that athlete that they want to be, the astronaut, the scientist. Because when you lose your health, you think of nothing else but to gain it back. You spend all of your energy towards that aim rather than the thing that you want to do. So this, I like this slide. It's a little bit outdated, fair enough, but it kind of shows the trend. This was taken from the United States, I believe. It shows a trend in childhood obesity rates in the United States. Now, this is very similar to what's happened throughout the industrialized world, so that's why I keep it in. But as you can see, the rates have dramatically increased, and they're expected to plateau in about 30 or 40 years, but by then we're going to see a tipping point where we simply cannot care for all of our overweight adults. The next thing I want to talk about is diabetes, which relates to obesity. And according to the WHO, type 1 and type 2 diabetes in children are on the rise. Now, yes, this can be related to being overweight, but we think is caused by something else. Now, the interesting thing is that it's an increase of 4% year over year for every age group, except for the 0 to 5s, which is actually a 5% increase, which is faster than we would expect. Interesting enough, 85% of all type 1 diabetics have no family history whatsoever. So they're the And unfortunately, Ireland does not. It is very close to being number 1 in the rates of childhood diabetes. I think the UK is higher than that. Asthma, another childhood disease we generally see quite a lot of. 1 in 5 children in Ireland has it. That's about 500,000. And the unfortunate thing is, as some of you well know, that it is a very dangerous condition to have because one person every week dies from asthma and tuberculosis. Now this is, according to the latest studies, 90% of these are preventable, which means if we can prevent the disease from happening in the first place, we don't have to worry about it. A whole food plant-based diet will actually do that, as I'll show a little bit later. Ireland is the 4th largest prevalence of asthma in the world, and unfortunately, it is the most common chronic disease in childhood. Eczema. I see a lot of eczema in GP surgery, and the interesting thing to note here is that this is what I'm seeing on a ground level, that the vast majority of the children are under 6 months, 65% in this case. This is very important because it does affect, it puts a lot of stress on the family, particularly, and it puts a lot of pain on the child because they're constantly itching or scratching, and it's just an unpleasant condition to have. Now, the thing to note is that 60% of these infants with eczema do end up having one or more of these symptoms in their childhood. So they carry the disease on them. They don't grow out of it, which is what we generally tell our patients. That's what happens. So I'm going to break this down into about 4 stages. So break down into pre-pregnancy, pregnancy, the breastfeeding time scale, and then everything afterwards, just to make it easier to kind of situate things. So before I start all this, we've talked a lot about the benefits of a whole food plant-based diet. So I hope by now you're all, if you're not convinced by now, then I don't know what more to tell you. The evidence is quite overwhelming. But there's a couple of caveats to that. Obviously, how does this affect a pregnant mother? Should she be doing such a radical type of diet when she's carrying a child? Or how can we do this with the child themselves? Well, the answer is yes to both of these. And this is borne out by the fact that the Dietetics Association of several countries, including the UK, United States, Canada, and Australia as well, they all agree that this is an absolutely viable way of living and a sustainable way of maintaining proper health. So, having said all that, pre-pregnancy, so I'm not going to be going into a lot of details because a lot of it's already been said and a lot of it does carry over already, but the health of the child begins well before the child's conceived. Put that right out there. If the mother's health is optimal, the child's development in utero will be optimal. Chances of all the childhood diseases decreases just across the board. Of course, there are some things we need to supplement, which is folate, vitamin D, and B12 at certain stages, but the vast majority of the mother's needs are managed with a simple whole food plant-based diet. And that comes down to fiber, minerals, vitamins, phytochemicals, and the last thing I forgot to mention is exercise. Super duper important. We all kind of understand that by now. So a whole food plant-based diet actually has been shown to reduce some risks associated with pregnancy. And there was a couple of studies done which showed that vegan pregnant women have a lower risk of emergency cesarean sections, less postpartum depression, and there was lower neonatal and maternal mortality. And there were no negative outcomes associated with higher than average. So all in all, positive outcomes. In regards to preeclampsia, vegan mothers generally had a lower rate of preeclampsia, going from 32% down to 3.7%, so quite a significant drop. And gestational diabetes, which is a big topic where I'm at the moment. The maternal diets that were associated with low intakes of fiber and high glycemic loads, which basically means very little fruits and vegetables and high processed foods, and are having a much higher rate of gestational diabetes. And this was borne out by the Nurses' Health Center too, which was just quite nice in terms of statistics. But it's interesting to note that just adding a bit of fiber to the diet reduced the caused the risk reduction by 26%. Just 10 grams a day, and that's, I think 10 grams is equivalent to 2 apples, roughly. So just 2 apples a day was all it needed to reduce it by a quarter. So it's fantastic evidence right there that the more fiber you take in, the lower the risk of developing gestational diabetes. And fetal growth weight. This was shown in two separate studies, I think a Danish one and a Mexican one, that showed that the higher the rate of vegetables, particularly green fruits, resulted in less gestational related problems, more importantly, improved fetal growth. So there was no tapering off generally in the last month or two. That was fantastic news there. The last bit was the, Shireen touched on this a little bit, regarding the N-nutritional compounds associated with processed foods, smoked fish and cured meats, as well as the byproducts of fossil fuels, known as polycyclical aromatic hydrocarbons. A bit of a mouthful, there you go. The whole food plant-based diet actually did protect against the negative effects of these two particular cancer-causing agents. And particularly, if the mother is exposed to the N-nutritional compounds and they have a whole food plant-based diet, they're actually protecting the effects of the N-nutritional compounds on the fetus itself. So the N-nutritional compounds will affect the fetus by promoting neurotube defects and enhancing or increasing the risk of pediatric brain tumors. The compounds in a whole food plant-based diet protect against that. So this was already shown, but this was kind of what I was hoping to hammer home, is that the majority of the N-nutritional compounds come from that group 1 area, the processed meats, the bacon, the sausages, salamis, the processed foods. And this is something that I found very interesting because I have mentioned this to my colleagues in my surgery, and nobody's really aware of this. So I don't know how many of you guys were aware of this, but this is a very important bit of information because group 1 carcinogens contain cigarettes, alcohol, drugs. Processed meat is right up there with them. So that's a very important takeaway. And the amount of parents that I've actually mentioned that to, and they come away looking at me like I've got 2 heads growing off my shoulders because they've never heard this before, is quite astonishing. So breastfeeding. The WHO has been very clear upon this for over a decade. Breastfeeding should be exclusively done for a child for the first 6 months of life. Exclusively. It is to achieve optimal growth, development, and health, and thereafter, to meet the evolving nutritional needs, requirements, the infant should receive nutritionally adequate and safe complementary foods while breastfeeding continues the first 2 years of life and beyond. So, why do I bring it up in this fashion? I'm not sure if you're aware, but Ireland is ranked pretty poorly when it comes to breastfeeding of children. I'll get to that in a minute. I want to hammer it home just yet. The reason I bring it up is because breast milk, as mentioned by John earlier, is nature's ideal mechanism or vehicle for transporting nutritionally good food to the child. There's no better source. No other species comes close, whether it's cow, goat, whatever. So it's important that our infants, who are our future, our potential, they should receive the best nutrition that nature can provide. It comes as no surprise that this is the stance that I am taking. Unfortunately, that's actually not what's happening on the ground. So, breastfeeding is vital because it has so many positive effects. It reduces respiratory infections, reduces complications of them, reduces urinary tract infections, reduces bone and joint infections, reduces gastrointestinal issues, and reduces the cases of SIDS. And so much so that the European Union made it very clear in this statement that the reduction in morbidity associated with breastfeeding seems to be a significant magnitude, substantial public health, and economic significance. Meaning, quite simply, the more you breastfeed, the less burden on the medical system, and the more productive hours of work the family gets. That's basically what it comes down to. The Institute of Public Health in Ireland, in 2017, published their report, and they were using the National Perinatal Reporting System in 2015, just outlined where Ireland is. And it showed that of all the recording, only 58% of the babies that were discharged from hospital were receiving any breast milk upon discharge. That means whether it's exclusive or part of a top-up regime, any breast milk. The HSE followed up 3 months later, and they found that that level dropped off to 35%. So only a third of children were receiving any form of breast milk. Now this is, by far, this puts Ireland at the lowest rates of both initiation and continuation of breastfeeding in the world. Just think about that for a second. In the world. Yeah, I had to read that twice. I had to get my wife to read that too, just to make sure I got it right. So this is kind of a good example of what should not be happening. So this is the natural trend of breastfeeding in mothers from day 0 on to a 1-year period. It should, yes, it should decline, but not at such a rapid state. This is far too fast than what it needs to be. And keep in mind, this is starting from the 58% of children that receive any breast milk on leaving the hospital. So we're already starting at a lower level than need be. And just to put it in context, Australia, that number is not 58% of children, but 91% of children who leave hospital start on some breast milk. In the United States, it's something like 88%. The UK is something like 85%. So you can see we're well below our complementary countries. So if you were to follow this, 1 month, we've got 60-70%, not so bad. 3 months, we see a significant drop-off, down to 40-30%. Around that 6-month period, a significant drop-off because, well, they were only told to breastfeed up until 6 months, not beyond that. The other thing I wanted to mention here is, according to the study, there was a very strong correlation between the maternal education work level versus breastfeeding. So the higher the level of the maternal education, the greater chance of breastfeeding will occur. Now, this is of particular note to me because I work in a slightly lower socioeconomic group in the UK, and I tend to see a lot of this bearing out fruit. The numbers aren't so drastic, but you do notice that correlation. So if you do work in an area, or you are associated with people who work in that area where it's a low socioeconomic region, you might need to put in more emphasis on the breastfeeding to get that number up there. Because as you can see from earlier slides, breastfeeding does have potential, has positive benefits for the child. It's very important. So just to hammer this home a little bit more, there was a cross-sectional study done in Germany that showed about 9,300 children. And what they found was that breastfeeding alone reduced the chances of the child developing obesity by the time they entered into school age, by the time they entered school. What was interesting in the study as a side effect was that they found that it wasn't just lifestyle factors associated with breastfeeding, but it was the actual composition of the breast milk that was the determining factor. So again, this goes back to the point of the mother's health, the mother's nutritional excellence or optimal nutrition is important as well for the child. And there was another study done in Lebanon this year actually, earlier in January, which showed about 1,000 toddlers. And it was quite clear that with exclusive breastfeeding alone, they reduced the number of visits to the pediatrician, reducing prescriptions, access to daycare went down, and risks of the usual complications of colic, otitis, and UTI all diminished. So this is not unusual data. This is fairly common sense stuff, but I thought it was important to be addressing this in a way that puts some numbers behind what we already knew. So what happens after breastfeeding is done, or rather when we start to wean off the breast milk and begin to add on complementary foods? Well, as I mentioned earlier, the dietetic associations from the UK and from America and Canada, as well as Australia, and I believe there's a couple more, they all agree that plant-based diet is safe for all life stages, whether it's child, an infant, toddler, breastfeeding, pregnant, what have you. Okay? So long as it's nutritionally varied, consistent, the density, the nutritional complexity allows it to be a very good pyramid, and we've already talked about that. I think John showed that the pyramid, not the triangle, but the pyramid, is actually very complementary. Just to hammer home a couple of this, there was a large meta-analysis done in 2011 that showed that the Mediterranean diet and other diets consistent with high fruits and vegetables had decreased the rate of asthma and allergic outcomes and atopic dermatitis, all which are associated with your asthma and eczema kind of outcomes. And then there was another cross-sectional study done that showed, done on 50,000 children, that showed a decrease in asthma and disease-related illnesses. And if the child remained on a strict Mediterranean diet, which to be fair isn't so hard, but we'll get to that a little bit later. Upper respiratory and lower respiratory tract infections, something I see all the time, particularly during the changing of the seasons. They, again, the Mediterranean diet was the diet that was used in this control, and very pronounced changes in outcomes. So after 1 year, 54% of the patients had no episodes, where before they were having an average of 4.6 episodes of infections a year. Antibiotic use decreased by almost 90% in that time period, where before it was 3 to 3.8 times the year receiving. And our symptomatic treatment also increased, and family satisfaction with the management was very high, which means satisfaction is high, compliance is going to be high. And eczema. A study of 20 patients with allergic eczema were placed on a vegetarian diet, and at the end of 2 months, their disease scores, which was part of the subjective and objective symptom, were cut in half. So that was of a slightly older age group. And I wanted to show this last one because I think it was fascinating. They were talking specifically about probiotics in children, and they found that if you administer probiotics, you would actually protect against the flare-ups of eczema. And it's mentioned before that fiber is a prebiotic food source for the natural microbiome. So the more fiber you eat, the greater your probiotic intake is going to be, the healthier your gut biome, and therefore the better protection against eczema. So high fiber, by now, I hope you all believe that it's very good for us. In children, it's exactly the same thing that we see in adults. It improves bowel motion, reduces constipation, which I've seen my fair share of, so far too many. But yeah, they also serve as a very good source of bacteria for the microbiome, helps keep weight under control, keeps insulin under control, reduces cholesterol in the older children, and it's full of antioxidants and chemicals. The lack of dietary fiber, someone mentioned last bit, was associated with a high body fat in a sample of British children. 15 grams of supplemental fiber, along with the energy-restricted diet, was found to result in 2 kilogram higher weight loss. So, in a very short period of time, we can. This is the average fiber intake for children. That's what it should be anyways. So as you can see, we're looking at 31, 38 grams per day. And that's quite a lot. But if you're just looking at it from a fruit standpoint, you're going to have to be eating a lot of fruit. If you incorporate that into every meal, breakfast, lunch, and dinner, it becomes very simple to manage. So, what can we do? Don't be afraid to bring up the subject. I know when I first started, it was very difficult for me to broach the subject rather. Parents would look at me with, why are you bringing this up? Well, yes, I'm not a nutritionist, but I've done enough research and I've done enough of my own management with my children to know that it works, that the research is there to support it. So please, try and give that advice. Remember, you do no harm by offering a plant-based approach to life. It will be helpful in the long run. Repetition is the key. You have to continually hammer home the message They may not hear you on the first time, they may not hear you on the second time, but eventually they will. And they'll take it on board and they'll start making small incremental changes. And those incremental changes will snowball into bigger changes down the road. And one thing I get a lot of is, can I do this while I'm taking medicines or while my child is taking medicine? The answer is yes, they're not antagonists. I know I spend a lot of time on breastfeeding, but I find it extraordinarily important and I need to get that word out. So, pregnant mothers, mothers-to-be, the whole food plant-based diet is fantastic for them. It paves the way for a healthier child. Regarding breastfeeding, in Ireland, we have 2 very good websites that can help promote that. In fact, I did a quick search of that. And that was breastfeeding.ie. These are all the sites in the Dublin area that actually offer support to encourage breastfeeding under the WHO terms. So what else can you do? Remind parents that it's a slow slog. It's going to take time, and at every opportunity, replace junk food with healthier foods. It's out of sight, it's out of mind. Parents need to lead by example. You can't be eating that hamburger and tell your kids to eat the broccoli. It just doesn't work. They see what you're eating and they want what you have. That's just simply the way kids are. So eat by example. Lead by example. And encourage avoiding processed foods and meals to your patients at all turns. And of course, there's lots of resources online. These are the ones that I use for my patients. I find it very useful also as specific issues. Final takeaways. I hope that today's presentations in total have been helpful for you all to make that confident change and make that confident advice to people. My takeaway is simply start early. The earlier you start with children, the better their outcome will be. Prevention will always beat management any time of the day. Provide encouragement at every opportunity, and this empowers the patients to take your advice forward. And be consistent in your messaging. Always repeat and encourage, and allow the family to trial things and rule things out that don't work. So it's an individual struggle for each parent to get their kids to eat. And I will leave it with that.